Hello, and welcome to Riverside's Breast Cancer Awareness Month speaker series. Riverside is pleased to present a new community talk on a different breast cancer topic each Wednesday this month at noon. 1 in 8 women will develop breast cancer in her lifetime. Knowing your risk factors for developing breast cancer is important to understand, as it may influence your screening strategy for early detection. The earlier breast cancer is found, the easier it is to treat and recover. Today's talk is presented by Dr. Andrea Avalos, a family medicine physician with Riverside Primary Care Mercury West. Dr. Avalos will share information about lifestyle choices that may influence your risk of developing breast cancer, discuss factors not within your control, as well as when you may consider genetic testing. Dr. Avalos?
In the United States, 1 out of 8 women will be diagnosed with breast cancer in their lifetime. Now, this is a very increased number throughout the last few years. And there are some risk factors that we will discuss in a minute in regards to things that we can and cannot control. The biggest risk factor in regards to breast cancer has always been being female. And this means genetically being born with an X and X chromosome, where you are born an anatomical female. Although men can indeed get breast cancer, this is not as common. This is a small graph with some information and data in regards to breast cancer in the United States as well. Now, the younger you are, the more unlikely it is that you get it. However, it is still at a higher number than before. So right now, 1 in 1,000 women can indeed get breast cancer starting at age 30 to 39. As age gets higher, there is an increased risk for having breast cancer. In regards to 50 to 59, it's 1 in 48 women. In regards to 60 to 69, it's 1 in 23, and so on. The younger women, at this point, we are not doing yearly mammograms for people 30 to 39. We should, however, discuss that with your doctor. If in the event that you feel like you are noticing something abnormal in your breasts, it is very important to share that information with your provider. From 40 and above, you will probably have a mammogram done on a yearly basis. And I know that sometimes during this pandemic, we have had patients who may have skipped a year because of this. But we are hopeful that in the next, now we are able to screen everybody in a safe way. And we're hoping that people will be able to come back and continue their annual mammograms. In regards to family history, so even though, yes, family history is a huge risk factor, there are up to 70% of women who will be diagnosed or have been diagnosed with breast cancer without actually having a family history. That is why it's very important to continue to screen everybody who is able to get screened. In regards to factors that we have no control over, so the biggest one overall is genetics. Like I mentioned, anybody who is born anatomically female is at an increased risk for having breast cancer. Genetically speaking, there are some populations that have a genetic predisposition. You may have heard those common terms like BRCA1, HER2. There are some genes that indeed you're born with that make you more likely to develop breast cancer. Most of the time, these will be discussed with your primary care doctor or someone else, and I will speak to that in a minute. In regards to race and ethnicity, usually, well, unfortunately, Caucasian women are at increased risk for breast cancer as a whole. However, people who are African American actually have a worse form of breast cancer, a very aggressive and deadly in most cases, unfortunately. So it is very important that everybody does indeed get screened. For genetic testing, having a close relative means that it is a direct family member, either a mother, father, sister, brother, someone who is directly genetically linked to the person. That is how we make that determination of the risk factor. Whenever somebody gets genetic testing, there are different ways that can happen. Usually, besides asking questions about the family, it involves some sort of blood work, and it will lead to having a special visit with someone who will address whether or not you have or do not have the risk factors. This can be done through your primary care doctor. There are a few referrals that can be done very easily. I also wanted to speak in regards to the fact that dense breast tissue is actually very common. There are plenty of women who have been told that they have a dense breast. And even though this sounds a little scary, it is important to know because there is an increased risk for cancer overall. There are some other testing that can be done in terms of imaging studies where we can distinguish better what this breast tissue is, like how dense it is and how the likelihood of having cancer hidden in there is. There is no need to test more often. However, it does depend on what kind of conclusion it comes after the radiologist has read this. And the last thing I should mention, obviously, exposure to estrogen and use of estrogen medications can indeed increase your risks. And even though you may not know that that is something that you have already been exposed to. Things that you can avoid or things that you can help as a whole have always been things that a healthy lifestyle should be part of. So alcohol use has been involved in different kinds of cancers, and unfortunately, in this case, breast cancer is one of those. Tobacco smoking also been associated with a lot of different cancers. Same with breast cancer, it actually increases a lot of your risk. In terms of healthy lifestyles, we also discuss weight in general, and this means mainly that as much as you can, if activity can be possible, then that's something we highly recommend. There is an indirect link between fatty tissue and estrogen and cancer that is still being studied, but it is indeed has been noted to have a risk, part of the risks that we are talking about today. And then, like I mentioned, there are some menopausal therapies that we have been able to use. Most of them are based on hormone therapy, and these can also increase the risks for you to develop breast cancer. Like I mentioned, in terms of genetic testing, usually this involves a few different things: having a consultation with a specialist, making sure that you have an appropriate family history information. If there is access to a specific person's data, meaning if your mother had testing and now you know which kind of genes were present, then it can be easily tested on you. If there is not present, you can still get genetic testing. It just means that we'll have to figure out other ways to figure out. It just means that we will figure out how, what your risks are and what kind of genes to test for. This may also include, besides genetic testing, may also include starting early mammograms or screening at an earlier time than the general population. Overall, though, in terms of breast cancer, it is very important to be aware that every woman should be able to get screening, especially after 40. But even before then, like I mentioned, it is very important for you to discuss that with your doctor to see if you have an increased risk and to know whether or not you should start early screening mammograms.
Thank you, Dr. Avalos, for empowering us with this information today. We encourage you to discuss your risk factors with your healthcare provider so together you can determine the best breast cancer prevention strategy for you. Early detection is in your hands and your best defense in the fight against breast cancer. Know it is normal for how your breasts look and feel, and alert your healthcare provider to any changes right away. have a clinical breast exam beginning age 21, and have an annual screening mammogram beginning age 40 for those women at average risk. Riverside invites you to share this information with your friends and family, as the more we share the message of early detection of breast cancer, the more lives we may impact. Thank you for joining Riverside's Breast Cancer Awareness Month speaker series. For more information about screening and early detection, or to schedule your mammogram, visit us online at riversideonline.com.